getting to a more unpleasant topic, I know you mentioned renal.
Yes, kidneys.
I think some cats, I think it just seems standard around 16 to 18, they go into renal failure.
Yes.
And you can notice, I've noticed like they lose tons of weight.
Mm-hmm.
So at what point do you know, dog or cat, when to put the animal down, sadly?
That's a tough question. When they're in kidney failure, first of all, their blood pressure goes up because your blood pressure plays a role in, your kidneys play a role in blood pressure control. And instead of having a stroke like we would, they actually go blind. Oh. They blow out their retinas. Oh. And you'll notice that because their pupils will be large in bright sunlight. You know, your pupils in bright sunlight
are going to contract.
Yes. Okay. So, and plus, like you said, they lose weight. Your kidneys get rid of your toxins. So when your kidneys are bad, they just keep, the toxins keep circulating. A lot of times that's upset stomach, so they'll vomit. So a good sign is when they quit eating. Eating to an animal, just like to us, is a pleasure. We love it. So the other thing I wanted to mention besides kidney failure is they can get at ages 8 and above, an overactive thyroid, hyperthyroidism. And that's another reason why they'll lose weight, they'll have a tremendous appetite, but because their metabolism is so fast, because they're hyperthyroid, everything's going faster. So they'll have diarrhea, they'll eat, but it doesn't metabolize well. And the other thing is we've now traced that. We see very few outdoor cats that become hyperthyroid. More indoor cats that are well taken care of because they're tracing it now to the forever chemicals, the PFAS, that's in treatment of fabrics and things.
Carpeting,
we're looking
whatever.
at that that are holding in those chemicals, and the cat is laying on there.
Yes.
Cats and dogs can be sentinels like the canaries in the coal mine for different things that we're not.
Okay.
So kidney disease and hyperthyroidism, and then diabetes is big in cats too. If you have a cat that's drinking and eating a lot but they're losing weight, take them into the vet. We'll run a quick blood sugar on them. Oh my God, it's 300 and some. Wow. And so there's a new drug out for cats, an oral liquid for diabetes. But believe it or not, it is not difficult to give. It's easier to give a cat a shot under the skin of a little bit of insulin than it is to give it a pill daily. Believe me. When we had, in our practice, when we had cats on allergy shots once a week, most owners said, oh, I don't think I can do that. And I'd give them a shot and we'd still be talking. They're like, did you give it? I'm like, yeah, it's done. Wow. Oh, I can do that. So don't let that scare you. If your cat becomes diabetic, you know, 13% of cats get put to sleep when they're diagnosed with diabetes, and that's really no reason for that. No.
Oh, that's too bad. Well, one other thing that when cats get older, don't they start becoming more vocal? Like they'll start yowling?
Yes, they do. And I was up at 2 a.m. last night with my 20-year-old cat.
Okay.
Yes, and we're still not sure. With mine, it's I peed, quick come and clean the box, I pooped, quick come and clean the box, or I'm hungry. So it's one of those three things.
Okay.
And when it's not that, I'm thinking it's cognitive, like you're talking about here.
Like old people.
I think they're just, they have, what is it called when you're wandering around at night? I can't
sleepwalking?
No, not that. But there's something, there's a disease that like night wanderers, I can't think of it offhand, but people that are up all night wandering around and then sleep all day. Because I guarantee you that cat is asleep right now.
Okay.
Yeah.
Okay. Because again, some of these folks I've house sat for, I noticed.
Yeah, they're up crying.
Well, yeah, he just, you know, and you're like, okay.
And you can't believe that sound could come out of that little 8-pound body.
Yes,
yeah, I hear you.
Yes, okay. On to a different topic.
Okay.
If you want to be a donator like I am, because I don't have a pet currently, and there's so many good organizations out there, how do you choose to know that you're going to be giving to an organization that uses their money wisely?
Right.
Because I know I donate to one in Geauga County that has received 5 stars from something that evaluates nonprofits.
Yes.
So what was your suggestion on, so you know the money's going to the right place?
You can always look at that. And some of the smaller groups, for example, Golden Treasures Rescue, I know the person that runs that. I see the work.
Yes.
She runs herself ragged. You know, going to the Amish and getting these dogs that they don't want anymore and they're going to just let loose or, God forbid, shoot. You know, and so you know, you can get to know the people that run those organizations and you know what kind of person they are. I would say the bigger the bigger, more national ones, I would check on more so than the local
locals.
ones. And also, talk to your veterinarian. You know, when I was in general practice, we worked a lot with a lot of rescue groups, and we know, you know, who was quote unquote good and trustworthy and who wasn't.
Okay.
Because sadly, some people go into animal rescue and then you see they get raided because they've got 20 dogs in the bathroom, and you know, then the county's coming to shut them down. So yeah, you've got to, veterinarians, we as veterinarians kind of know who's good and who isn't. So you can always ask the local vet in that area.
I donate to a few, and it's funny how you get on these lists, and then
you hear from everyone.
I mean, I've gotten something from a pig sanctuary in Tucson.
Yeah.
So, you know, you just end up whatever. But at any rate, I have my few, and like you said, I know that they're good people.
And it's nice to stick to local.
Yes.
You know, charity begins at home.
Yes.
And it's nice to be able to actually go and see that charity and what they're doing, and all the good that they're doing. Yeah.
And what if you want to breed your dog, or if you have the type of dog that would be part of that function? I mean, how would you?
Well, I think everything should be spayed and neutered, including humans. I think, you know, I work with so many rescues that well, I don't know if you'll see both of my rescues today. One's from China, which they're raised for meat, the Yunnan Meat Festival, which is dog meat festival. And the other rescue's from the Amish. She was a brood mare. We call them a breed mama. There are so many wonderful dogs that are getting put to sleep every day that I don't know why we need to breed.
Yeah.
Okay.
Yeah.
And it's the same with cats. And you know, cats come into heat. They're called induced ovulators. I mean, you can induce a cat to breed just with a rectal thermometer right after they've had kittens. So it's not like the every 6 months like it is in dogs. So, you know, we always have kitten season, and that's we have kitten season right now.
Yeah.
So yeah, it's spay and neuter is the way to go. It's the only way we're going to get the pet population down and get these poor, wonderful dogs from being put to sleep on a daily basis.
Or cats as
That
well.
cat loves Cheryl.
Yeah, I guess so. To a different topic, how do you discipline your pet in a loving way?
Well, the production crew today has seen that our dog, as a vet, they just kind of do, we don't have children, so they kind of do what they like to do, and you'll see when we bring Annie out later. You know, I hate taking that joy away, but I also don't want her shredding your clothes. So, you know, we've had her 3 months. Yeah, I wore white pants, which was a bad idea, but we've only had her 3 months, and that's no excuse. But, you know, she's never really had any human interaction. She's just been a puppy mill mama her whole life. So we're working on that. You know, my first thing is jumping. When I walk her at Hinkley Lake now, when people with the dog are passing us, or people, she stands and looks at me, where's my treat? Which is a piece of her dog food, by the way, as I mentioned earlier. So we're working on it.
Okay. Yeah. Well, that kind of ties into another question. What if you realize that you've brought a dog or cat home and they just have some behavioral issues that are not the norm?
Right.
Where do you begin with that?
Yeah. Well, I would talk to your veterinarian about that. They're the first place to go. Okay. And then there are boarded veterinary behaviorists. We have one in North Olmsted.
Okay.
And there are trainers. But just like with kennels and grooming, you need
to get a referral.
You need to get references for a trainer, because pretty much it's kind of like personal trainer. You can kind of put your shingle out there. You know, I want to see some background there, and I want to talk to other people who have been there
and had results.
Yes.
Okay. Now, since we've had so many horrible things in the news lately, whether it's flooding and fires, I think it's worth discussing again. We may have in the last interview, disaster preparedness and evacuation essentials.
Okay.
Because if you not only have a disaster like your house is on fire, or there's an earthquake if you live out there in LA or something, but also if you have to evacuate your property due to a flood, like what they had in East Palestine with the toxic spill, what do you need to do to have your animal? Because you don't want to leave your animal behind.
No, you don't.
Know, so
you want to, you want to have. And we were victims of Hurricane Ian. Thankfully, we weren't there at the time. It was September 28th. We hadn't gone to Florida yet. But you want to have all their paperwork, just like with your paperwork, including all their vaccines, because some places won't allow you to stay there unless your dog is vaccinated.
Oh, that makes
so make
sense.
sure you have all the papers, all the tags, that kind of thing. They're going to run and hide. They're going to go to the, for example, in a house fire, they don't know to go out the door. They're going to go in a closet or something.
Okay.
So God forbid, if you're not home, you've got to have neighbors. And this happened to my pharmacy technician.
Mentioned this one.
Her stove caught fire. And she was my tech. She had 2 dogs. She had just adopted a rescue. It was in a cage under her counter in the kitchen. The neighbors ran over and said, wait a minute, there's another dog in there. So they got the one dog out. The fireman crawled in on his hands and knees and pulled that cage out and saved that dog. Thankfully, the neighbors knew. So it's nice to have your neighbors know. Also, you can buy those little red stickers on the door that says, hello, thank you, Mr. Fireman. There are 2 dogs and 1 cat in this house. Now, the problem, same with the cat. They're terrified. They're going to go to the most confined place to hide. So you've got to do your best. You've got to respect all the warnings. God forbid in Maui, apparently there weren't any warnings. But if you're lucky enough, like in a hurricane, get out. Anyone that I've talked to that stayed for Hurricane Ian said they would never do it again. And we lost a lot of animals there because they were put in their carrier and on top of the refrigerator, and guess what? That water was higher than the refrigerator.
Oh my
and I don't know of a worse death than being in a confined area that you can't get out of and drowning. Or in a fire. Right. So you've got to, let this be a lesson. Be prepared today. Get your plan, just like you get your kids a plan to get out of the house. Make sure someone's responsible for the pet. Have a carrier upstairs and downstairs. You can throw them in there, grab it, and get out.
Very good.
Even if you put the cat in a pillowcase, you don't have to have a carrier.
That's a good idea. That's a really good idea.
We used to have people that brought the cat to the vet in a pillowcase. So
no, that's a very good idea. Something practical, but
that you can grab
functional.
right away. Exactly.
Well, that kind of segues into my next thing. As pet essentials, if you're a new pet owner, you may not even think, and I would think disaster preparedness should be part of it. What are the things you're going to need right away, cat or dog? So,
well, certainly the microchip. Everybody needs to be microchipped. Have a leash handy, have a leash in the car, even carry a cat or dog carrier in the car. And when the dog is in the car, try to have it leashed like around the headrest there. You can put a leash around there and lock it. Because if you're in an accident and you've got a moonroof or sunroof, I can tell you the animal gets expelled right through there. And you'd never think of that, but that's what happens. Also, like we talked about the paperwork, you've got to have that handy. And any medications. If you have a cat on insulin, if you're on insulin. A lot of people in Maui right now, they're diabetic, they don't have insulin. So you need to have a bag of that and almost do a rehearsal. Like maybe, twice a year when you change the batteries in the smoke detector. Do that rehearsal. Okay, where's this? Where's this? Okay, this is the route which we're going to go.
Okay, because I would be heartbroken if something happened to my animal.
Well, and with elderly people too, if you live alone and you had to call 911, my first thought would be, okay, if they come in this door, my dog's going to get out. So, try to tell the dispatcher or call your neighbor and say, hey, listen, 911's coming. Can you put my dog in the bathroom? Close the door because, the doors are open while they're carrying you out. So that's another thought.
That's
You've got to provide for that.
That's a very good practical tip if something like that happens.
Yeah.
So, okay. Last but not least, this is very, very important because you've talked about this, but I thought, again, it was worth repeating, the importance of wellness checks.
Yes, I'm a big blood work person. Okay, so anytime I get a new dog, a rescue, even if it's a young dog, which these 2 are, I get what's called a CBC profile. CBC, complete blood count, tells you what their red count, their white count, which we see with infection, and platelets, which tell you how to clot. Then we'll get a serum profile, which tells you your calcium, your potassium, your sodium, your liver, your kidneys. I want to get that as a baseline because say 6 months from now, I have a dog that's vomiting or has diarrhea. I'm going to get blood work and compare it to that. Oh my gosh, her protein is low. Well, maybe low protein is normal for that dog, but we had something to compare it to. Especially if you're adopting a middle-aged to older dog, you would add a thyroid panel onto that. Because low thyroid in a dog doesn't start till middle-aged to an older dog.
Well, I read something again, because I'm getting these requests for money, and I can't remember the organization, but they did a full page about how important wellness checks are, because they said an animal tries to conceal when they're not feeling well.
Absolutely.
And so you need to make sure that everything is normal, because they listed a checklist of what you look. They called it the nose to tail checkup.
Yes.
Which I thought was cute but relevant.
True.
So just to make sure everything's on the...
Well, you know, one of the most common cancers, for say in golden retrievers and large breed dogs, is a tumor of the spleen. So it's a blood tumor, and it's called hemangioblood sarcoma solid tumor. So it's a solid blood tumor, and it grows slowly on the spleen or in the heart, and then little pieces of it will just rupture out. So the dog will be walking along and maybe just faint. Oh my God, what's that? You know, well, it's because they're losing blood from there, and then it seals up and they're okay. That, you can have a dog that looks fabulous today and will be dead in that yard tomorrow, because they don't act like anything's wrong. So that's why a physical exam once a year for young to middle-aged dogs and twice a year is so important, because your vet will palpate that abdomen and palpate that spleen. Now, he can't palpate the heart. You can take an x-ray of the heart, but that hemangiosarcoma is such a shocking loss, because the dog never acted like it had anything wrong with it. So that's why the wellness checks are very important. Blood work and a physical exam. It's not enough, although vaccines are fabulous and they're very important, the dog needs to be examined, like you said, from nose and ears to the tip of the tail.
Because one of the things they also emphasize that we don't take into consideration is that a dog ages faster, because you know how they say 7 years to one human, so their bodies are going to change over the course, and so there's going to be different things to be looking for.
Things happen much faster, it seems.
Yeah, so that's a good idea to keep that. Okay, well, do you have anything to add before we bring our willing participants in?
Yes, too willing. Just a couple things on the subject of cats, and we'll bring little K here. Little K is a gold cat. Most gold cats are males. Occasionally you'll get one that's a female, but most gold are males, and most calicos or tortoise shells are females. So gold cat male, calico tortoise female, and you know, they're just, cats are cats. I mean, it's hard to get them to do anything. You can train them, that's for sure. But always, and we'll hopefully show you on little K, always check their nails, because sometimes those nails grow so fast they grow totally around into the skin, and people don't realize that.
Well,
so we'll see if little K will let us look at
Well, you know, I'm going to ask you another question about when a cat lays on its back and allows you to rub its belly, is that an indication that they trust you? Because somebody told me that. I'm just curious.
They trust you, or they want to act like your prey, and they'll kind of grab onto you. So some of it do it for playful reasons.
Okay, all right. That was all I was going to ask. So, okay.